Cancer treatments can come with unexpected challenges, including the risk of infertility. But thanks to modern medical advancements, more options are available for those hoping to conceive after treatment. Let's welcome Dr. Heather Cook, Reproductive Endocrinologist at Coastal Fertility Specialists. Dr. Cook, great to have you here with us today.
Thank you for having me.
I want to start off by talking about how chemo, the effect it has on our reproductive.
Right. So chemotherapy is obviously very important and needed to essentially kill off whatever cancer it's treating. Unfortunately, that can also have impacts to other growing cells in our body, specifically eggs.
Okay.
And so for our women who are having to face fertility issues while they're going through chemotherapy, it can really damage the eggs for later reproductive purposes.
Do different types of chemo have different levels of impact?
They do, and so that's something that we would generally have the patient as well as ourselves speak with the oncologist about, because clearly the type of chemotherapy is going to differ depending on the type of cancer, but they do have different impacts.
Okay. What options are available now for patients that have a cancer diagnosis but do want to preserve their fertility?
So the best option really is to try and get the eggs out of the body and freeze them for later use before they're ever exposed to the chemotherapy. So our biggest concern is that after a woman does her chemotherapy course, that she's not going to have any usable or healthy eggs for the future. And so if we can get those from her and get them safe in the freezer while she does her chemotherapy treatment, we'll be able to have a better chance when she's finished.
How long can we freeze eggs for before we have to use them?
Great question. So we think indefinitely. You know, once eggs are in the freezer, they really don't change. They don't worsen in quality or success rates over time. And so those will be there until the woman's ready to start her family.
What about the difference between freezing your eggs and your embryos in a situation like this?
Great question. We get a lot of questions about this because previously freezing eggs was very difficult. Now with the techniques that we use in the laboratory, we're able to freeze eggs extremely well, and so they function pretty much as well as embryos. And so if a woman is not in a relationship and doesn't have a sperm source, we would always recommend freezing eggs so she has more options later on.
Is there any impact of freezing your eggs or your embryos on the cancer treatment?
Generally, the answer is no, but clearly our first priority is getting the woman healthy. Second priority is fertility. So when we're talking to somebody about freezing their eggs, it is a joint discussion with their oncologist on, is this safe for her? Do we have enough time to do this? Or does she need to start her chemotherapy immediately?
And I want to talk a little bit about age. How does this factor into preservation options that are available for women? You know, if a young girl gets diagnosed versus, you know, an older woman.
Yeah, there's definitely differences in women who are pre-pubertal or have not started having menstrual cycles or don't have ovarian function yet, where we think those ovaries and eggs may not be as affected. Unfortunately, with breast cancer, you know, these are generally reproductive age women who are menstruating, whose ovaries are functioning. And so in that specific group of women, we do see harm to the ovaries and to the eggs.
Does the stage of cancer, when diagnosed, have any impact?
Probably only in the sense of the type of chemotherapy and the amount of treatment that's going to be necessary. And so again, that's something we work with the oncologist about, like, are we going to be needing surgery first and then have a break before chemo where we can do the egg freezing? Or is it going to be straight to chemo prior to surgery? And what part of that, what point of that is it safe to try and freeze some eggs?
Okay. Where can we go to learn more about Coastal Fertility Specialists?
Our website is always available. You can call for any questions. Don't need a referral to schedule an appointment with us. And usually for our patients who are facing cancer diagnosis, we will get you in immediately, even same day or next day, because we do know time is of the essence.
Okay, that's great to know, Dr. Cook. Thank you so much for coming in and speaking about such an important topic.
Thank you.
We're back after this.